Thank you so much, guys. Now our last practice for the heart. Again, we know how to find the anterior side. We just have to look for this interventricular groove, right? And then you confirm, not confirm, that this is the anterior side of the heart by looking at this, the pulmonary trunk. Sorry, pulmonary trunk. Okay. So now we're gonna identify some of the other stuff. If I put a pin here, you say left ventricle because it's got the apex. Pin there, right ventricle. Yes. Pin here, what is that structure? Auricle, which side? Left, exactly. Left auricle. If I put a pin here, I'm talking about the structure, right auricle. If I put a pin in the same vicinity, I'm talking about a blood vessel. What would you say? Vena cava. Vena cava, right? Because the vena cava goes on the right side. All right. If I were to kind of sort of ask for this branch right here, this would be the brachiocephalic trunk. Okay, excellent, thank you. May have to move some of these deals. Okay, because it might be one of the blood vessels I ask for. Okay, I'm not only going to ask just for the great vessels, just so watch out because we get this brachiocephalic trunk. So this one is the aorta. Okay, exactly. And you can see how it's curving the aortic arc. And then if I put a pin on the side, I'm talking about what that blood vessel is, or blood vessels. What would you say? Pulmonary veins. There's four of them that come over here, right? So that's all the great vessels. That's all the structures on the outside. Interventricular sulcus or interventricular groove. We cut and we see what's inside. Well, this is the septum. Interventricular septum. Interventricular septum. Sometimes there was that muscular ridge separating the major chambers of the heart. You say interventricular septum. Okay? Sometimes I say, what's that string-like structure? You see, I almost nicked it. And then this will be the moderator band. The one we sort of called septomarginal trabecular in the lecture a little bit, but marginal moderator band is good with me right now. Okay? All right. What is this valve right here? Oh, where is it going, by the way? What's that? It's a semilunar valve, and it's going in here. Bam, like that. Okay, so that's the aorta, right? Aortic semilunar valve. Okay? What about this valve? What's this valve right here? This valve. What's that? Why do you say that? Look how small this is. Yeah, and the right has got the tricuspid. Yeah, thank you so much. So that's what you need to do in the exam, okay? You need to sort of watch for that. Watch for the size of the ventricle. If the size is small, you choose for the one with the most cusps, okay? That's how you do it. I mean, you just go like that, and then you say tricuspid. The one with the biggest is the fewest cusps. Tricuspid. You use those little tricks, they work for you. Okay? So if I put a pin here, what's this valve? I just told you. Bicuspid. Remember? I said you look at the big chamber and then you say to yourself, okay, it's got fewer cusps than bicuspid. You look at the small chamber, you say, okay, it's got the most cusps, tricuspid. Okay? That's how you do it. And this is, of course, the aortic semilunar valve. The pulmonary semilunar valve is going to be inside here. That might be too hidden for us to go to, but it's right in there. Okay? And these muscular ridges are called? Can I answer? Right? Remember? Those will be trabeculicani. These are trabeculicani. You see? Trabeculicani. And then over here, in the auricle, what are these muscular ridges called? Musculi pectinati, or pectinate muscles, if you like. Pectinate muscles. Yay. Okay, that's it, really. For the heart, we've identified all the structures. We've identified all the internal structures. Well, maybe not all of them. Okay. What are these little pimple-like muscles? Papillary muscles. This is a papillary muscle. Boom, boom, boom. What about the string-like structures? Chordae tendini. Chordae tendini. Okay, you should know that, guys. Friday's exam. Chordae tendini, musculi pectinati, trabeculicani, pectinate muscles, bicuspid valve, aortic semilunar valve, moderator band, tricuspid, also this side, okay, interventricular septum, okay, and there's the aorta there picking out, and there's of course the brachiocephaly